Afternoon, everyone. We'll be talking about dyslipidemia and diabetes. Basically, what is cholesterol? Cholesterol is a fat-like substance which is made by your liver, and the cholesterol is actually produced by your body as well as from your dietary sources. There are two types of cholesterol, which is actually bad cholesterol and good cholesterol. Good cholesterol generally is described as HDL, and bad cholesterol is described as LDL, VLDL, as well as triglycerides. There are various targets which are described for HDL and LDL. Generally, a target of HDL more than 50 for males and 40 for females is prescribed. And LDL targets, now it is being changed that for patients who are at a very high risk of atherosclerotic cardiovascular disease, a target of 55 is prescribed. Triglycerides, the target is less than 50. And how is this being produced is majority it is being produced by the body, and even your dietary factors helps in deciding your body cholesterol levels. Generally, when is this cholesterol levels needs to be tested is generally patients who are using for a regular checkup and all, they need to be evaluated with lipid profile levels every once in 6 months. So twice a year. For people who needs to be evaluated regularly, like high risk atherosclerotic cardiovascular disease and all, they need to be checked once in 3 months. And some people might have to be checked even after 1 year of 1 month of starting therapy who receive revascularization treatments. And how does diabetes affect it? Diabetes basically leads to insulin resistance, and these people develop something which is known as diabetic dyslipidemia, which is more common in the Asian subset, where these people will have more of central obesity, type 2 diabetes mellitus, insulin resistance, which leads to increased triglycerides levels. This is known as diabetic dyslipidemia. And the most important factor of this high cholesterol level is this leads to increased lipid growth and atherosclerotic plaques in the brain and in other organs of the body, leading to heart attack, MI, kidney failure, accelerated hypertension, and more. And how do you need to, what are the causes because of which it raises? Basically, your dietary factors, smoking, increased stress, and genes, and being overweight. All these things leads to increased cholesterol levels. And how do you treat them? Generally, there are two types of management of how you treat it. One is lifestyle management and one is drugs. Lifestyle management basically includes using a regular exercise of at least 150 minutes per week of moderate intensity activity, reduce smoking, decrease alcohol intake, take foods with good cholesterol levels like nuts, avocado, and prevent taking foods like reheated oil, and control your sugar levels and preventing a sedentary lifestyle. And other than tablets, drug lifestyle changes, there are something known as drugs which can be used like statins, and the other new modification like ezetimibe, bempedoic acid, those things can be used. And even if they don't work, monoclonal antibodies like evolocumab and all can be used to treat this dyslipidemia. And if patient doesn't respond to all these things, some people might even require plasmapheresis.